One of the greatest athletes in history, Michael Phelps, was diagnosed with ADHD as a child. Another world champion, David Popovici, was introduced to swimming at 4 years old due to spinal problems. One struggled with focus, the other with posture. But for both, swimming was the solution, and both became Olympic champions. In today's episode from What Sports Science Says, we discuss swimming and how sports science explains transformations like these. Please subscribe for more content like this, and let's begin. Swimming helped Michael Phelps channel his hyperactivity into structured movement. Sports science shows that swimming is not just physical training, it is also neurological training. The combination of rhythmic movement, controlled breathing, and aerobic effort improves attention control, and neuroscience demonstrates that this type of activity increases dopamine regulation, serotonin levels, and brain-derived neurotrophic factor, which is essential for focus, learning, and emotional stability. In the water, Phelps' excess energy was no longer a limitation, it became a performance advantage. This is why swimming is often recommended for children with attention or emotional regulation issues. The water removes distractions and enforces rhythm, timing, and control. Sports psychology highlights swimming as a powerful tool for mental regulation, and studies have shown that it reduces stress, being successfully used in youth development, rehabilitation, and high-performance recovery. For example, a study conducted by UK researchers recommends swimming for depression. Their research on 53 individuals observed immediate positive changes in mood, improved mental and physical health, and increased motivation. If you swim, how does it make you feel while you're in the water? David Popovici began swimming at the age of 4 as a form of rehabilitation for his spinal problems. He started attending the pool regularly, and swimming eventually became his full-time job. The Romanian athlete went on to become a world champion, world record holder, and Olympic champion. Why was Popovici prescribed swimming by his doctor for his spinal issues? Because swimming is one of the few sports that strengthens the body without compressing the spine. The buoyancy of water reduces gravitational load, while muscles continuously work to maintain proper alignment. Sports science demonstrates that swimming improves core stability, activates deep spinal muscles, and promotes symmetrical muscular development. This is why swimming is often recommended in early childhood, and why athletes like David Popovici build their foundations in the pool. Sports medicine increasingly incorporates swimming into rehabilitation programs for post-surgical recovery, neurological conditions, chronic pain, and joint degeneration. Water allows movement that may be impossible with land-based exercise. For example, a study conducted in the United States found that all patients returned to swimming after hip surgery, most within 4 months. More than half were able to swim better than before surgery, with significant improvements in pain and physical function. A similar conclusion was drawn from a study of individuals who underwent shoulder replacement surgery. Most returned to swimming, improved their swimming ability, and enjoyed it more than before surgery. From a biomechanical perspective, swimming is one of the most comprehensive forms of movement. Unlike land sports, the body moves through a dense medium, water, where propulsion, drag, and body position continuously interact. Biomechanical research shows that swimming activates nearly 90% of skeletal muscles, depending on the stroke. This is one reason swimming is frequently used by athletes from other disciplines as a form of training, since water provides constant resistance with minimal joint stress, allowing for long-term, high-quality training. Swimming creates unique cardiovascular adaptations. The controlled breathing, breath-holding phases, and the horizontal body position all contribute to these unique physiological changes. Sports physiology research shows that swimmers develop increased stroke volume and enhanced cardiac efficiency, as well as a high VO2 max comparable to that of endurance runners. Additionally, swimmers exhibit improved lung function and superior breathing control. They often show endurance profiles similar to those of runners or cyclists, but experience far fewer overuse injuries. Swimming is also one of the most inclusive sports. In Paralympic sport, water minimizes physical limitations and maximizes physiological potential. Athletes with various impairments apply the same principles of cardiovascular conditioning, technique efficiency, and neuromuscular control. Paralympic swimming shows that success is not about perfection, but about adaptation. For many Paralympic athletes, swimming is not their first sport, but their second chance. We can conclude that swimming is about more than just speed or winning medals. It fundamentally involves adapting both the body and mind to the surrounding environment. If you enjoyed this episode, please like and subscribe for more content on sports science and sports culture. Of course, we also look forward to reading your thoughts and impressions.